Hello, and welcome to Level Up Stronger. The world is continuously changing at a very rapid pace. How can we all gain the competitive edge in our industries and thrive in them? What if you knew without the shadow of a doubt that self-education and access to forward-thinking experts in your field could catapult you towards success faster than ever before? The spaces we inhabit can inspire us, protect us, define us, and connect us, so we all play a valuable role in shaping their future. We plan to take a deep dive into various industries and careers. What are the future of the industries? What are the barriers to entry? And learn from the very people who thrive in them. We will take you behind the scenes to the people, products, and processes that keep industries thriving. In this podcast, we look forward to inspire and empower everyone to take thoughtful, educated risks and apply what we've learned in our lives so we can all level up stronger. IEI is a small woman-owned business who believes that through diverse leadership, being innovative, investing and empowering employees, IEI is equipped to excel in the challenges of the future and succeed in the present. IEI does this by utilizing understanding of environmental, construction, facilities, and property management services to connect clients with superior skilled staff who have solutions to achieve their goals. IEI believes it has the right mix of employees and capabilities to provide stellar client services with excellence and integrity. Today, we want to give a broad, multi-layered view of how the pandemic affects this small business, this small woman-owned company, and how you've rose to the challenge to level up stronger along the way. We have a super diverse group of people on the IEI Lunch and Learn meeting today. Owner Shanti Dabare, CEO Sameda Da Silva, vice presidents, division managers, project managers, and field staff. Welcome, IEI team, to the podcast. But first, I want to start off with Sameda. As a company owner, how did COVID impact your business and services?
COVID did impact our business in many ways, but the primary way that it impacted our business was having the ability to go into client site. One area that got impacted significantly is our BAS group, because most of our BAS work is overseas work. We support DOS OBO. And because of the pandemic, a lot of international travel got suspended. And OBO canceled a lot. So we started trying to implement methods where we can troubleshoot problems, BAS problems, remotely. To a large extent, we were successful, but in some cases, we were not successful because you actually have to be present to reprogram, change VAV units, and so on and so forth. So, and that's one of the major areas that got impacted. In addition to that, on the positive side, we were well positioned to pick up some new work in terms of temperature screening and COVID cleaning. Because we were an abatement company, we had the necessary tools and the personnel to go into facilities that had been impacted by COVID patients, and start cleaning them out and disinfecting those areas. We also had the opportunity we had a contract with FOH, Federal Occupational Health, which supports a lot of other government agencies. So because we were a contract holder at FOH, we were also successful at winning work with the temperature screening for different facilities. I believe Sandra and Rushan did a tremendous job of recruiting people, getting people to go to these different sites, do the temperature screenings. We also had the ability to support other remote, actually automate temperature screening by putting remote systems to monitor temperature for HOC and HOC and another facility. Overall, the financial impact was negative, but I wouldn't say it's negative. It's been positive, really. But certain business lines got impacted, but they were offset by new business lines. So it was a mixed basket, honestly.
Awesome. And did you find that the culture of the company was at all affected by COVID during the onslaught of the pandemic?
It's a good question. I think I responded to a WhatsApp text recently. IEI didn't really get impacted in terms of our management process, our leadership, because way before COVID, we had remote working. Most of our senior staff work remotely. You, Tiffany, you're in Kansas City. Our proposal shop is in Ohio. And most of the senior managers work from home. It's only a handful of people that show up at the Maryland corporate headquarters. Um, the only real drawback was that a lot of people who came to that Maryland office didn't get a chance to interact. But overall, the functioning of the organization was hardly impacted by it.
So Maida, are there changes due to COVID that were intended to be temporary, but that you found they worked well, that you'll keep on a longer term basis?
Yes, certainly. We have found out that that remote working is actually not a bad thing. I'll take a case Vanessa's case. She's in our accounting department, and she actually quit coming to the office. And she said that she doesn't want to come to the office again, even post COVID. And I don't see a negative impact at all. In fact, if she likes working from home, that's great. The only a handful of really only a handful of people who need to come to the office. The warehouse manager needs to be in the office. The office manager needs to be in the office because we have deliveries, we have samples that we collect that needs to be chain of custody and send out. The warehouse has to get shipments prepared. So to answer your question, yes, we have found out that I'm not going to force anybody to come to the office unless it's a critical function that's an office-based function that needs to happen. So my philosophy going forward is to minimize the office space as much as possible, cut out that capital expense of having to maintain offices that are not really necessary, and moving on to a much more remote-based work environment.
Great, thank you. Well, now I'd like to move on to the division managers. What unique challenges did you face for your team in being able to continue to provide services despite COVID's limitations?
I can go first. I know for me, my staff are all considered essential. So although, because we work in government facilities, the facility still had to be maintained, even though a lot of the government staff and the public were no longer in the federal buildings that we run. But we saw a huge uptick in the amount of COVID-related additional services that we were being asked to handle. So a lot of COVID sanitization of buildings and facilities for our government clients. So whereas all of our existing staff, our biggest challenge was making sure that we kept everybody safe so no one got COVID and or gave it to our entire team. And we did have those challenges, especially last year after the pandemic first started, where, someone would come in and have been exposed and then expose the entire team. So there were a couple of periods where we had entire teams that had to go into quarantine, and we had to adjust staffing to handle that. And the biggest, I think, challenge for us is just continuing to keep up with the services that the clients are requesting, because the longer the pandemic continues, we started to see a little bit of a drop off in services where they weren't being as requested as often. But now that the variant has started, we're seeing an uptick again in some of those requests. So contracts where we thought they were only going to last a couple of weeks, a month, maybe tops back in, June of last year, have now gone on for well over a year and keep getting extended. So making sure that we have a labor force that's available to be able to do those additional things has definitely been something that we have had to deal with. And also just, again, keeping everybody safe. We were able to relax the mask mandates, and now I think we're back to that. So I'm worried about the safety first and foremost of the staff, because at the end of the day, we can't provide services to our clients if we don't have staff to do it. And then also major supply chain problems. So when, especially last year, and we still continue to see it. There's supply chain problems. Other companies that we depend on who provide services and supplies also have pandemic related issues with being able to get and/or service things that we need. And so it's taking longer than normal to get all of supplies, and also services are taking longer than normal to get accomplished. And so continues to be a challenge there in just the fastness of everything getting accomplished compared to what it was before.
Thanks, Tiffany. And how has that affected your client relationships? Have they been understanding of that? And have you had to adjust much to accommodate any changes in policies of staffing or hours from a client perspective?
I think in the beginning, they were very understanding. I have seen, though, as time has kind of gone on, they tend to forget. As we've all kind of settled into this, we believe that we go to the grocery store and we can get everything we need, right? So you would think on a personal level, the supply chain isn't an issue. However, a lot of the parts and major mechanicals and stuff like that come from large factories or even overseas. And so those supply chains are still greatly affected. Other companies other countries are in shutdown, right? Other organizations are in shutdown. We kind of live a little bit in a little bubble in the United States to some respect as to what's going on overseas. And a lot of our materials and supplies come from those locations. In addition to that, there was a huge uptick in the or change in some of the protocols. So we had to increase the efficiency of the filters that we were using in all of our buildings. And so that greatly impacted all of a sudden now all buildings have that same requirement. And so the supply and demand of some of the things that we use was a huge challenge and will continue to be going forward. So at times the clients have been understanding, but the longer this becomes the reality of what we do every day, the more they maybe err towards, oh, well, everybody's ready to get back to, business as usual, but there still continues to be those effects to other companies and suppliers that we need to take into consideration. So, I mean, that I think is going to continue for a while.
Thank you, Tiffany. Are there any other division managers that would like to share their experiences?
Yeah, I can, Julie. So in our division, the housing division, all of our work is just came to a halt at the beginning of this. And early back in March, when everything started shutting down, all of our work started shutting down. And there wasn't really a plan in place for moving forward. In the beginning, like Tiffany said, we were all just waiting for it to kind of blow over. We thought we might shut down for a couple of weeks and then we'd be able to get back to work. It started at the end of April into May, we started to realize that wasn't going to happen. So we started to look at how we could move forward and still support our clients, the public, without and going into properties where we were putting ourselves in danger, putting our clients in danger, putting their participants in danger. So we looked at different ways we could move forward. So we started looking at the process of, do we have to go into these units? Do we actually have to physically walk in and do that? About in November, actually HUD, who we work with a lot and oversees all these projects, they actually kind of got on board with the idea of doing virtual inspections. And so that's where we had already kind of had that process in place. Even when their direction came out, they kind of gave us the thumbs up on doing those. And so we started presenting our clients with the idea of us doing virtual inspections instead of going into the units physically. We were lucky to have clients that were willing to give it a try. It took a lot to do that. We had a process that had been in place for years that we were wanting to change. And the participants on these programs were not really receptive to that in the beginning, because it would be very easy for the inspector to come in and do this job without them having much input. And this required them to help us. So, it took a little bit of education. It took a little bit of explaining how it could be done effectively to our clients and to the participants, and we were able to put it in place. And we've been doing that successfully for many of our clients over the last year. So, it was something that we didn't think about doing it that way in the beginning, but the pandemic and COVID gave us an opportunity to kind of think outside the box or the norm. for all the terrible things that it's brought us, it did allow us an opportunity to kind of say, okay, how can we use, more innovative processes to do this type of work? Even in a non-pandemic situation, there maybe it's time to move this process to the next level, because it hasn't been changed for so long. So we took that opportunity to do that, develop these processes, and we're still we're still doing that as well. I mean, we're not done. We're still looking to find out where we can find more efficiencies and better ways of doing things, better applications we can utilize. I think we're on a good path to not only just do this during COVID for the safety of everyone, but actually to innovate the process in general. And so it's something that I think we've done a really good job of. And I think that we have the ability to maybe move this on to the next level, and maybe others will adopt it as well. So that's what we've learned from this process, and how it affected us is, we were just pretty much sitting doing nothing and worrying about how we were going to continue. And it was definitely affecting our clients, and it was affecting the companies, certainly our revenue. So we had to come up with something. And I think that in that, we found something amazing, and we've been able to really put it in place and do good work.
Thanks, Melinda. Can you tell me, how did that affect your staff? Were you able to do that with your existing staff?
Yeah, I think with anything new, there's reluctance in the beginning, and people need to understand it and what your vision is, and how their role is in that. But once our staff understood what we were trying to accomplish and how it could absolutely be better for them for safety, but not only for that, they can do more in a day. And it cut down on a lot of our travel costs and things of that nature. And if you've ever, tried to drive around in a major city to get to point A, B, and C in a day with traffic, you can find that, that's a very difficult task. So doing it in this manner allowed them a lot more time to focus on doing their job and not worrying about how to get somewhere in a timely way. So they were receptive to it. We've been able to use our existing staff. They adapted to it. I'm actually very proud of the way they've adapted. We've done well. And I think that we've shown that this can be done in a different way with staff that maybe was used to going to the field and doing, their work out there, but they've been able to find ways to communicate well their message to the participants, to the clients. And I think it's been very successful with our existing staff.
Thanks, Melinda. Are there any other division managers on who would like to share?
Yeah, Julie, let me go next. Like we do a lot of work in secure facilities, and the work we do is usually under, there's a lot of people looking at these projects. Like two things we had to change. One is active prevention. This is where we had to totally redo the way we enter the site. Like we instilled questionnaires before entering these sites, and then we started tracking temperatures before work and after work to kind of see patterns, or to kind of figure out if someone's getting infected. And we opened up the communication so that people were informing us when they were going on leave, so we could put them on a 7 to 10 day quarantine. Essentially, we took a very conservative approach on prevention of the spread. Those processes have basically enabled us to work without a stoppage of work through the entirety of last year. In a certain location, we had almost 35 to 40 personnel working together, and we were able to kind of proceed without huge shutdowns. Like there were instances where the facility itself shut down, but it really did not impact our schedule.
Thanks, Kosala. Can you tell our listeners a little more about what kind of projects you manage?
This is construction and abatement work in very specialized environments. And like one of these sites, they have very specific air control. Like it's basically an isolated system where the air gets filtered and transferred back. So like we have to, when we're working in these environments, like especially with a very large crew, we have to kind of take the precautions to make sure that we are following all the, we're going above and beyond the protocols in place to make sure that we are not bringing in contaminants. And we were actually commended for our approach because we were very, very open. As soon that it was not that there was a lack of cases, we had 2 to 3 personnel, but we were able to identify them beforehand and put them in quarantine without them impacting the rest of the crew. And the second action we took was preparedness of resources. Like a major thing that happened, like going on what Tiffany said, was the PPE was basically nowhere to be found in 2020. From the months of like March through October, like there was no Tyvek suits. Like we kind of like speaking to our vendors, we kind of realized this was going to happen. We had purchased large stocks in place. That's also helped us move on with the work without any stoppages.
Thanks, Kosala. And did you have difficulties in geographic locations if you work in different states?
Yeah, because each state has their own protocols. For example, Pennsylvania, like residents and people who work there were allowed to enter the state. But if you're out of state, you have to place yourself in quarantine once you enter the state and provide evidence of that to the place of work. So there, like each state had their own different way of dealing with it. So yeah.
Sameda, can you speak to what the environmental department impact was? I know they did, or maybe even Sandra, who's on the call. You guys implemented some additional things for your clients, temperature screening and all of that.
To answer your question, yes, Tiffany, I think we had a bunch of clients that wanted specific services that were COVID focused. The environmental division was clearly able to support them because the type of work we were doing, they knew the type of work we were doing, so they asked for specialized services. For example, HOC wanted their air filtered. So we had these, for abatement, we use microfilters. We use some of those microfilters to filter the air out of the HOC compound, HOC buildings, their office spaces. In addition to that, they wanted specialized temperature monitoring systems placed in their office as well as their multifamily homes. So when a resident walks in, they would get their temperature measurement and they would use their key card to ensure that they can actually enter the building if their temperature was normal. And then there was a specialized project where MDE, I think Malinda is on the call as well, so they can speak a little bit about the COVID testing that we're doing in wastewater, because that's a specialized project that we were able to land through MBE to monitor the upswings in COVID cases in the community. Dilni or Malinda, can you guys talk a little bit about what you guys are doing there?
Yes, Sumedha. As you said, we are our wastewater monitoring to identify COVID-19 uptick, how the dynamic goes. So basically, we have 2 major clients, Maryland Department of Environment and HOC. For MDE, we basically collect samples from Baltimore City, Montgomery County, and then recently we expand towards Eastern Shore, a few treatment plants from Eastern Shore, and we have some other sites at Cumberland all the way to Auckland. So there we collect samples from wastewater treatment plants. The closer sites, Baltimore City and then Montgomery County, we are collecting samples from manholes. So basically we collect weekly samples from manholes, 2 to 3 samples from treatment plants and pumping stations. And then we test those samples to identify the dynamics of COVID-19. And then we are helping MDE and HOC how to respond to the dynamics or the upticks of the COVID-19.
Yeah, so on the MDE project, I'm a bit involved in that too. In one sentence, it's essentially tracking wastewater. It's basically sampling wastewater to track the spread of COVID in the greater Baltimore area. That's the objective of this study. Like Malinda and his crew does a lot of good work setting up these like 24-hour sampling, tracking the virus, especially in communities and small townships. On the compliance side of the environmental group, most of the federal, as you guys may know, like most of the DoD, the federal side, they were working from home. On the compliance is an essential task. Like our samplers were initially, before the vaccine came out, it put them at risk. They were able to get into these sites. Like there's multiple sites that we collect samples from. We had no issues getting the work done.
I also want to hear from the other staff that are on the call, not just the division managers, the field staff and the project managers. How did COVID impact your given job site locations? Were there any unique challenges that you faced?
This is Ana Maria, and before the programs that we have, there were very interesting challenges. And one of them was really the cultural change of an organization, the corporate mentality of the client. How am I going to overcome this situation? We were developing programs that required field deployment and a lot of traveling from our subject matter experts. For the first time, we addressed the virtual training platform as it was meant to be. And that was the first ever at the environmental management program with DOE, for example. And we succeeded on that, and we got exceptional evaluation. But with that said, we established a game change in the way that certain activities at DOE are going to be conducted from now on. We are going to stag field evaluations, field visits with virtual visits and virtual meetings. And that has created a complete different mindset, is saving money and actually is maximizing resources. Another element that the team and the department and the clients learned and increase our business base is that these virtual activities really make the persons more focused and more concentrated in what they do. We sometimes, this transition between real and virtual, sometimes people would say, oh, okay, you're just watching something for the sake of watching. Well, this enables to pay attention more to detail, to business systems, to integration. And that was a challenge that the department and our clients had overall. So we ensure that, and also IEI step up to the plate, and it's consistently stepping up to the plate as far as business and project and program management integration systems are about. So technology is going to play a judicious path in this. That does not mean that we're replacing the human. And also office space will be utilized wisely, meaning that the client will be looking from time to time to have office meetings. So we need to have that infrastructure in place, but they are not really expecting that all of us are going to be there all the time. So we have had a win-win in multiple fronts. There are going to come other environmental safety and health issues. We focus exclusively about the COVID-19, but having individuals also working at home and also working in longer exposures in a virtual environment and other activities. And I'm doing that also in other aspects. We need to be also cognitive and monitor the health effects and the ergonomic impacts that can have in the professionals. Those are elements that this game-changing situation called COVID-19 created. Good, and also lessons learned and continuation of observational approach as far as CSNH goes.
Absolutely, that's all great.
Sandra, why don't you talk a little bit about the projects that you managed and how COVID impacted your management style?
So one of our major emergency projects we had was through FOH for HHS. We had 4 locations, 2 major locations down, one in Rockville, another one was in downtown DC. And these operations were mainly 24/7 for the 2 locations that was in Maryland and Washington, DC, where we have to provide services for the staff, basically doing the COVID screening. And it was the morning and the night shift. So it was a 24-hour center. And we have to pretty much schedule over 20 to 25 staff throughout the week. And the other 2 locations actually down in Baltimore, the warehouses. So this project went on from the time we had the COVID-19 pandemic started. We provided as emergency services for FOH. It was a successful project overall for us, even though we had few things that to kind of figure out, especially when we had a shortage of supplies with N95 mask and gloves and so forth. But we were able to work it through and get everything as needed for our client. And the challenges that I faced, we had to coordinate a lot of things off-site, also to kind of ensure that our staff we also secured the new part of having the COVID-19. We wanted to ensure that our staff won't also be infected when they were doing this temperature screening. So there were some challenges that we had to go through the first couple of months, but we quickly had a good response with provided better communication skills with each staff members. And I think overall we had a good managing team to run the project. And we also supported HOC with 4 locations for elderly home cares with the temperature screening as well. We did the monitoring for them. And also that project was a short-term project, but it overall went out well for us.
That's awesome. We have some other projects that I think were greatly impacted. Dave Ailes, you work at the Military Family Housing at Wright-Patterson Air Force Base. Tell us a little bit about how you were impacted, because you've got the general's quarters and everything there that we maintain. What was the impact to that project during the pandemic and what continues?
Yeah, COVID has had a lot of impact on us. What we do here is we maintain 100 residential units for colonels, generals, key and essential personnel on base. COVID is severely limited. We fix anything that breaks around your house. We fix around 100 houses. COVID has affected the most minute pieces and parts that we need to get. Things you would never imagine would be affected by COVID, along the lines of the Air Force's regulations to have cordless blinds rather than corded blinds. That factory went down for COVID for 2 months, came back up for a month, went down again for a month. And so we've had a hard time supplying things like that. We installed vinyl floors, and I had a horrible time over the winter because my first option, his crew had COVID and he was down forever. My second option on floors was too busy and also had some COVID concerns. He couldn't be here. Yeah, it's just wreaked havoc on our operations.
It affected your ability to go into the houses too early in the
absolutely.
pandemic. You had additional safety protocols, right? For
absolutely. When this all started in March,
properties.
they took away. They said we're not going to do any work orders unless they're emergent, and doing emergent work orders required other protocols to be handled. But the minor things like a leaky faucet that people just don't want to have to put up with, they had to hold those things forever and ever. So then I started asking a couple people. It started with one lieutenant colonel that I knew was rather handy. I said, "You got an iPhone?" He said, "Yeah." I said, "Can you FaceTime me?" He said, "Sure." We actually started fixing things by FaceTime. The plumber or the electrician or whoever needed to do these things, because sometimes even when breakers go off, people don't realize, it sounds simple, but they don't even understand how to turn a simple breaker back on, that you have to turn it all the way into the off position instead of, to get it to reestablish. Little things like that. And so it started with this one lieutenant colonel, and we FaceTimed him. We looked at the problem. We said, "Get this, that, and the other tool and call me back." He called me back, and we did it by video. And then we started doing more things by video. We've really had to be creative to get things done.
Let's talk about what's the impact going forward. So COVID's not over, right? And now we have these new variants. What do we do now? What is it? Do we have any fears about what is going on each day? And as variants continue to wreak havoc on the population and are impacting people who have to go into the field every day, how is IEI going to meet the newest challenges with the pandemic?
I can answer that. I don't believe the pandemic is going to get done until 2024, 2025 timeframe. And there are various reasons for it, which I reserve my comments on. But in terms of managing the work that we have, we will have to adapt a lot more than what we have done in the past. We are going to an environment where primarily our staff is going to require to get vaccinated, right? So we don't want to talk about health and stuff like that much, but more often than not, I travel extensively for work. Places like Europe, you see a lot of protests going on because a lot of these cities and countries themselves, they're issuing the COVID vaccine passport. They call it a green passport or a vaccine passport. So basically you have to have it to enjoy or participate in civil society. Right. So places like New Zealand, for example, the prime minister comes and says, "No jab, no job." Right. We are not sure whether we can do that or not because the laws in this country are a lot more a lot more disparate in terms of federal, state, local, et cetera, right? So we're not really sure where this is going to go. So in terms of human capital that we have to manage, we are going to face some significant challenges here. So that's number one. Number two is going to be what we have already discussed in terms of supply chains. Supply chains are disrupted already, right? So we're faced with limitations in computer chips to limitations in getting polythene, right? So basically, poly is not available. Tyvek suits are not available that readily, and manufacturing in the United States has been hollowed out, right? So we already know that it's been happening for the last 40 years. So to get all of these stuff, even companies like Walmart is actually now keeping inventory. These are companies that were built on just-in-time production, right? So they produce it, bring it to market just in time. So the whole premise of just-in-time was to ensure that there is no warehousing costs and things like that. Right now we have inflation on top of it. So basically huge amounts of inflation coming. A lot more companies are going to start hogging a lot of the material that they need over a period of time. So which is a concern in two fronts. First, we are going to have issues with actually obtaining the material that we need because we're a small business. We don't have an enormous amount of capital to invest and buy things and keep it in warehouse. We do to a large extent, but we can't keep it in we can keep inventory for 2 years, for example. And then we have the issue of being a government contractor with rising inflation. We have five-year contracts, we have 3-year contracts, and we have to price these contracts in today's dollars to do work 5 years from now. And we can't predict inflation. And we are going to have a problem. And you see that with, like, for example, with our HOC staff, if we have to do physical inspections, that means our gas costs are going to rise, right? So this is where innovation comes in. Even in terms of baby steps, we have been very good at understanding what's going on in the marketplace, how COVID is impacting the overall economy, and we have been able to change a few things. Small things, like, for example, Melinda's virtual inspections, right? Having the ability to do virtual repairs, like what we're doing at Wright Patterson. So those things are going to be more prominent. Tiffany is talking about employing VR technology to walk buildings and understand doing QC. So basically, we have to make sure that we are tilting a great deal towards technology, to leverage the technology that's already available. We're not trying to recreate the wheel here. We are just trying to use the technology that's out there, repurpose it for our own requirements. So those are the things that I believe are going to change here. And when we do this, it's never going to go back to normal. And that's a given. When we start doing virtual inspections, we are never going to do a physical inspection again, unless there's an absolute necessity to do it. So those are the things that we are going to have to identify, and we are going to have to change.
I agree. This is Anamari, and I agree with you, Samida. And what you said, not going back to normal, it will be, actually, we're going to evolve, for lack of better words. Society is going to be a different society, not necessarily for the bad, or it's just going to be a new society, a new economy. And we are right now at that nexus, at that transition. One of the elements is that our healthcare approach is going to change, and perhaps what we call now a vaccination requirement may turn into a proactive measurement for health into the future. We do not know. The regulatory framework may, and the healthcare industry may drive that. That's one element. As far as technologies goes, we are certainly going to lean a lot into automation in order to maintain the inventory. That does not mean that the worker, as we know today, is going to be entirely excluded, but we are going to take into account worker safety, reduce the exposure of the worker, and number two, to make the process more efficient and maintain a reliable inventory. So IEI, as far as that goes, will be evolving in the sense of applying, like we have said, and actually our clients are also looking into that for major activities. Virtual reality, we are looking also at training, utilizing those kind of technologies as well. And we're going to be leaning in robotics probably to do some of the decontamination work that we're currently doing in our facilities and cleaning up. Now, with that said, the human element may not be gone, but we may have an operator that is working outside, manning controlling the technology and the equipment. So this is a great approach. What we say, going back to normal will be actually dealing with a work that is not only COVID-19, but we may have other collection of health issues that will be evolving. And the population that is the 2021 crop, 2035 crop will be trained and will be adapted to that environment. So we that are in the transition phase, that are really in the, we are actually evolving from the smartphone practically into robotics and automation, will be the leaders that will transform and make the society succeed or fail or just be in the middle. So that's really our mission at this point in time.
And I'm really super excited because this pandemic, while tragic and terrible, has really forced us to pivot into technology and innovation way beyond where I think we would have been had this not happened. And
I
so
think we've always been that company, Tiffany.
Correct. But this gave us a giant shove, I think, off the cliff, right?
Yeah, absolutely. The owners of our company have always allowed us to think outside the box. And we've done a good job of that, but you're absolutely right. For all the tragic things that have occurred, this has really pushed us to have conversations we may not have had.
Absolutely. And so for me, that goes back to, I think, and speaks to our mission as a diverse leadership, being innovative, investing and empowering employees. And so I really appreciate everybody in providing and helping to talk about what and shine a light on what's going on as far as the pandemic and the future of everything that we're doing. Thank you for joining us on Level Up Stronger. For references to resources mentioned in this episode and to receive updates on future podcasts, check us out on social media or at levelupstronger.com. And remember, each time we take risk, educate ourselves, and apply what we've learned to our lives, we level up stronger. Each time we level up stronger, we have the opportunity to reach back and contribute to someone else's success too.